Welcome to Mihiraa's English Listening Test for Healthcare Professionals. Sample Test 8. Part A. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a urologist talking to a parent called Mihiraa, regarding the 5-year-old daughter. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. And this must be Mia. Please make yourselves comfortable. I'm Dr. Rocker, the urologist handling Mia's case. Now, Mihiraa, your GP referred Mia here suspecting a UTI. Can you tell me more about what brings you here today?
Thank you, Dr. Rocker. Yes, Mia's been experiencing some discomfort when she uses the bathroom. Frequent urination, and it seems to sting a bit at times.
I see. How long have these symptoms been present?
About a week now. She started complaining of a burning sensation when she urinates, and she needs to go quite frequently, even at night. Sometimes, the urine seems cloudy and has a strong odor.
Have you noticed any other symptoms, like fever, blood in the urine, or abdominal pain, Mihiraa?
No, thankfully not. She seems a bit tired and cranky too, which isn't like her usual self.
Okay, that's helpful, Mihiraa. Have you tried any remedies at home to ease the symptoms?
We've been encouraging her to drink plenty of fluids, cranberry juice specifically, and I've applied a warm compress to her abdomen a few times.
Good. Those are both positive steps. Now, has Mia had any previous UTIs or other urinary tract problems, Mihiraa?
No, fortunately, she's been generally healthy. She did have a mild case of gastroenteritis last month but recovered quickly.
Excellent. Are there any allergies or medications Mia is currently on?
No allergies, and she relies solely on a daily children's omega-3 supplement for her nutritional needs.
Perfect. Now, to get a clearer picture, could you tell me a bit about Mia's lifestyle? Mihiraa, does she attend daycare, or have frequent diaper changes?
She's in kindergarten, so yes, she's around other children quite a bit. Diapers, of course, aren't an issue anymore.
Right. Given the symptoms and Mia's age, a UTI is certainly a possibility. Mihiraa, I'll need to perform a urine culture test to confirm the diagnosis and identify the specific bacteria involved.
Of course, what does that involve?
It's a simple procedure, Mihiraa, where Mia provides a urine sample. We can collect it here in the office, or you can take a sterile container home.
I understand. Is there anything else we can do in the meantime to help Mia feel better?
Absolutely. Continue with the increased fluids and warm compresses, Mihiraa. You can also try giving her over-the-counter pain relievers like ibuprofen, if she's uncomfortable. However, it's important to consult the dosage instructions carefully and avoid exceeding recommended amounts.
Of course. What about after the test results come back?
Once we have the results, I can prescribe targeted antibiotics to clear the infection. Mihiraa, we'll also discuss any other necessary steps, depending on the specific bacteria and Mia's individual case.
Thank you, Dr. Rocker. I feel much better informed and relieved now.
You're welcome, Mihiraa. Don't hesitate to ask if you have any further questions. We'll be in touch soon regarding the test results and next steps, including the possibility of a biopsy to further investigate any abnormalities.
Extract 2. Questions 13 to 24. You hear a family physician talking to a patient called Mihiraa. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. What brings you in today?
Oh, doctor, I was gardening yesterday and unfortunately I stepped on a rusty nail. And it did bleed quite a bit.
I understand, Mihiraa. Can you tell me more about the accident?
Yes, the nail punctures my skin deeply. I pulled it out immediately, but there was some blood.
I see. Did you clean the wound thoroughly, Mihiraa?
Yes, of course. I washed it with soap and water, then applied some antiseptic cream.
Any pain or swelling around the wound?
While there is a slight stinging sensation, there doesn't appear to be any accompanying redness or swelling.
And Mihiraa, have you noticed any other symptoms since the accident?
It's throbbing quite a bit. I'm also feeling a bit under the weather with some fatigue and mild muscle aches.
Have you tried any home remedies for the wound, Mihiraa?
Just the usual, doctor. Some turmeric paste and a bandage to keep it clean.
That's good. Now, Mihiraa, when was your last tetanus vaccination?
Oh, I honestly can't remember. It's been a while, definitely.
It's okay, Mihiraa. Let me explain. Tetanus is a potentially fatal bacterial infection that can enter the body through open wounds, like the one you sustained. The bacteria produce a toxin that affects the nervous system, causing painful muscle spasms, lockjaw, and so on.
What? That sounds terrifying.
It is, Mihiraa. Early symptoms of tetanus can include stiffness in the jaw, difficulty swallowing, and muscle rigidity. If left untreated, it can progress to respiratory failure and death.
Oh dear, this sounds serious.
Given the nature of your injury and the uncertainty of your vaccination history, Mihiraa, I strongly recommend a tetanus shot. It's a safe and effective way to prevent this potentially life-threatening infection.
Doctor, but wouldn't the antiseptic cream I use be enough?
While cleaning the wound is important, Mihiraa, it doesn't guarantee complete protection against tetanus spores, which can remain dormant in the soil for years. The vaccine, on the other hand, stimulates your immune system to produce antibodies that can effectively neutralize the toxin, even if you come into contact with the bacteria.
Doctor, you've made a compelling case. Let's go ahead with the vaccine. As you wisely pointed out, it's better to err on the side of caution. Thank you for your guidance.
Excellent decision, Mihiraa. This will ensure your safety and peace of mind.
Thank you, doctor. I feel much more relieved now.
That is the end of the test. Now check the answers.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.